Well, greetings again. This is Dr. Bill Wyatt, and I'm going to talk about a few things that happen to people and it slips up on them. You don't see what you're doing, and yet the thing that you do, or this can happen to an adult, and it happens to lots of children. And one of my great granddaughters, right at this minute, is tongue thrusting and causing her upper front teeth to move forward, and she's should have stopped this type of swallowing and everything back when she was about 2.5 or 3, and now she's 5 and heading starting to kindergarten and everything, and she is still tongue thrusting. Well, I'm not going to show her, but I want to show some other people some of these things. And here's a young lady who I've got a good picture of her tongue thrusting. It's hard to get when they actually are swallowing and putting their tongue in that position. But this is the picture that we got. And when she swallows, she goes forward with her tongue, and she doesn't bite the teeth together fully like you would if you stopped doing that. And I want to stop at this point and say, all the adults out there that are watching this, try to swallow now and not bite your teeth together. You'll find it very difficult to do. I have practiced to show people, and I can push my tongue up there and swallow and not bite together. And I thought I always bite too when I swallow, but this is not true. The other night I was trying to drink water out of a straw, and you put your tongue down there and you pull a vacuum with your tongue and pull back on it, and you bring your tongue forward to get this vacuum started, and you'll swallow without biting your teeth together. The next time you have a straw and some water or whatever you get, and you suck it on the straw, watch what your teeth do. You don't bite together. But yet, most adults, you say you can't swallow without biting your teeth together, and they can't. But I've done it so much that I can show people how to do it like that. But if you do that, it's going to cause your teeth to change position. And this is in adults as well as children. I had a 40-some-year-old man come in the office at one time, and his teeth were sticking out like a kid swallowing wrong. And yet I said, "Were you sucking your thumb?" And there's some adults that do that. He said, "No, I don't even think about sucking my thumb." Well, you don't play a clarinet and pushing your tongue and pushing out like that. No, he didn't do that. I couldn't figure out what in the world. How did your teeth, here he comes in with his front teeth sticking out just like a kid like this. And he said, "My teeth fit like that together, and I had to wear facets on them, and I could see where they had closed together. And now at 45, his teeth are sticking out." And we think adult teeth can't move, and this is a big, just a flat-out lie. Adults' teeth do move, and they can be moved all your life. And I went out of the room, I was getting behind, and I went to get caught up on some other rooms, and I'd come back to him, and the lady stays with him, and she talks to him, and then in a few minutes, I was working on another patient. She came in and said, Dr. Wyatt, says this man was trying to stop smoking, and they told him if he put one of these lozenges up and held it in the front part of his mouth, that he could stop smoking. So he's diligently put this lozenge there, and he would put his tongue up there to hold it and pressed against it. And here's a 40-some-year-old man moved his front teeth. His teeth didn't move out of the bone moved with his teeth. And I just couldn't figure out, I couldn't find out what he was doing. I've seen grown people that, even though they're grown, suck their thumb, and it'll change their teeth. And if you are blowing a clarinet and you hold it like this, it'll bring your teeth out. And if you do it properly, it won't. So these are things that happen to us. Now, since we're talking about these, we call them deleterious habits, or these things that happen like this. My granddaughter, great-granddaughter, is swallowing wrong, and she's 5 years old now, and her front teeth are sticking out like this already. It comes up real subtle like. Now, if she had stopped infantile swallowing pattern, if she had stopped that when she was about 2.5 or 3, her teeth would have stayed there. But they continue that pattern. And that's when a child is nursing, they do not bite. And when you're sucking on a straw, even as an adult, you can close your teeth. And if you're pulling a vacuum up, you put your tongue up there and you pull back with your tongue, and it creates a vacuum and sucks the water or whatever, the malt or thing you're drinking, sucks through that straw, and you can bite your teeth without, or you can close your teeth without biting together. Now, if you don't bite together, there are people who are chronic mouth breathers. And I am not a chronic mouth breather, but I am a mouth breather to a great extent. And your tongue is in the bottom arch when you breathe. I don't care where you are, who you are, what color you are, or anything else. If you are a mouth breather and you keep your mouth open, your teeth move toward one another. They don't get longer, they don't get bigger or anything, just the whole bone structure and the teeth move toward one another. And if you do it enough, you develop a long face in here, and you usually have your mouth open a lot to breathe, and the upper lip doesn't grow down to cover it much. And I used to do that, and they had me. My mother worked for an orthodontist for 25 years. I sat in his office and watched him work. He was a labiolingual man, and he straightened my teeth up. And I was a mouth breather, and he had me pulling my lip down like that and stop, breathing through my mouth if he could. Well, he got me stopped, and now my upper lip covers my upper front teeth, and they are long teeth, but my lip covers them. And so you can pull that down, and you can change the shape of your lips if you want to. Now, if you're a mouth breather, it doesn't make any difference. You may be a moderate mouth breather, or just a very rare mouth breather, or you may be one that breathes through your mouth all the time. And if you do, your teeth are going to move. They don't get the same pressure. Now, I do not count how many times a person swallows, but people who do is somewhere around a couple of thousand times a 24-hour period you swallow and bite your teeth together. And this closing together of your teeth determines how far these go down and how far these go up, and the place you meet in here. And we have a normal vertical height of the lower third of the face, and it'll be about this much, and the height between the tongue, between the nose and the forehead, and then from the forehead on up will be another third of the face. And the faces on normal people will nearly always have those thirds of dimension. And if somebody's doing something wrong in there, they'll have a longer face. And that messes up the appearance of nearly anybody. If you add a whole inch or half inch to this length right here, you run around looking different. So these are things that you look. Now this young girl here is tongue thruster, and my great-granddaughter, who is 5 years old now, is doing this. So I found out you can change this if you want to. Like you can. Now, if they're tongue thrusting, watch out that there's an airway defect and they can't breathe good. So correct the airway problem, and that helps this. But you can come in and take and band these lower front teeth right here. And I found the most efficient way to stop tongue thrust is to solder some wires on there. An 030 wire on the back of the tooth. Maybe we show that here. Let me see. Now we band those teeth, and I quit banding back in the 70s and had a whole lot of lower anterior bands, and we would put those bands on the teeth, and we would spot weld that 030 stainless steel wire, and you'd have it sticking up here, and then you come in and bend those wires over and clip them off so that they're not hitting the roof of the mouth, and you put that on, and that stops. The child swallows now, and the tongue will go up here and hit those things. And I had a physician who was a bad tongue thruster, and he was still doing that, even though he was a doctor, and he was still poking up. And I put these deals on him, and I said, I want you to tell me exactly how your tongue deals with this. And so he came back a few weeks later and said, my tongue has stopped going up there. It went up there, the tongue went up there, and this pokes the tongue in the bottom of the tongue a little bit there, just a little bit. And you poke it once, and your tongue go back in there, and it'd be sore, and it'll poke it again. And I'll guarantee you that they don't care who you are, your tongue will not go up there. It has a mind of its own. And you may talk, and you kind of don't use your tongue like you normally would, but it'll stay away from those spikes going there. Now, I had a lady, and we put 4 of these, and she was a grown woman, was tongue thrusting. And she said, I've got to quit this. And so I put 4 of these on the bottom like that. And she said, I still went over them. Said, can you sharpen them? And I sharpened them. And she said, she came back and said, I still go over them. And so I came in and put 3 up above and bonded them through the teeth, and I had 4 on the bottom and 3 on the top like that. And now she closed together and she called me up and said, that did it. And I mean, there was no way the tongue was going to get up there without hitting one of those places. But I've never had the tongue butcher itself hitting those. About the second time it goes up there and touches that, man, it just won't go there. So this is one way to get rid of some of these deleterious habits. Now, and I found out that children who breathe through their mouth have less blood oxygen, and they tend to wet the bed more. So go in and make sure the airway on a child is open and good before you actually stop the tongue thrusting problem right here. So thank you for watching. There's more to crooked teeth than people think about, and this can make the face grow completely out of proportion by just doing some of these habits. And I don't care how old you are, if you still are doing them, they will move your teeth. And how we got the idea that adults' teeth don't move, that the bone is set, it is absolutely false. Our whole body changes. You look at somebody when they're, say, 25 or 30, and they're in good shape. Then you look at them when they're 70, and they've gained 25 or 30 pounds, and their whole body's changed, and their bone structures change. Everything changes to manage the weight that we have. And so people, bone moves. I don't care who you are, where you tribe you are, or what part of the world you're in, your bone will do the same blooming thing. And that is going to be a fact. Whether AI believes me there or not, I don't know. But I'm going to sign off now and say goodbye, and I hope you'll watch our channels. And we've got a lot of videos out there explaining a lot of things about how people do. So thanks for watching, and I'll sign off here now.